We'll move on to our last section, which is health and wellness. So our first presenters are Jodie and Emma.
Hey guys, can you guys hear me well?
Yes.
Should I share my screen for our poster?
No, go ahead and introduce yourselves and then I'll move the slide.
Okay, perfect. So I'm Jodie Tam. I'm a junior here at the U of A and I'm studying physiology with a minor in special education. And I'm currently a trainee in the certificate program with the USED.
Hi everyone, I'm excited to be able to present to you guys today. My name is Emma Capranica. I'm currently a senior and I'm studying rehabilitation sciences. I am also a trainee in the USED program.
Okay, so our presentation for today was based on our involvement with our community portfolio. So what we did was Emma and I worked with Artworks. So that's a community-based art studio that's also a day program for adults ages 22 to 65 with developmental disabilities. And what we did, our goal was to promote health and wellness through everyday activities. So we went in once a week on Thursdays and we built really strong relationships with the people in the program. They were really excited to see us every week and they loved the idea of us asking them what they wanted to do and the activities that they had in mind. So we were really inclusive in considering what they wanted. So we used a collaborative approach to spread awareness on the importance of practicing healthy habits every day. So we've had informational sessions. For example, we did PowerPoints on healthy foods and the importance of proper nutrients. And we've also done a lot of hands-on activities. So for example, we did like yoga sessions, which was really fun. We've done like watercolor sessions with them. And we've done like walks and meal creations. We've made smoothies with the greens in their garden and they really enjoyed that. Last week, Emma actually brought in a puppy. And so that was really fun. And it was just a way to relieve stress for everyone. So we did some background research and we found that from the graph, I don't know if you guys can see it in the corner, but individuals who are more physically active tend to have better stress balance than the ones that aren't as physically active. So our goal was just to promote these little healthy lifestyle that you can do every day from your home to not only maintain good stress balance, but just to teach them easy things that they can incorporate into their everyday lives.
All right, so for our results, one thing that we found was everyone was able to learn a few new lifestyle habits, even if they were just small tweaks to what they were packing in their lunch or actually wanting to join in on the walk. And that was one really cool thing that we got to see as we kind of created relationships with the artists and gained their respect and gained their trust. We kind of had more involvement in our activities each week. And it was really awesome to see everybody look forward to wanting to like join in on our activities each week. So that was a really great side of it. And then they kind of had a changed mindset about healthy foods. The greens in the garden can be a little bit scary. And at first we would just pick them off and like bite them. And they didn't taste awful, but they didn't taste the best. But then when we kind of put them together in smoothies and in noodles, they realized that, okay, we can make this on our own and it's not going to taste that bad. So overall, we decided that anyone can exercise when they are given the tools that they need. We gained insight on individuals in different communities, and that was really beneficial for us because without Artworks, we really wouldn't have had the opportunity through any of our other classes to be submerged into a community like this. And we decided that health and wellness can be practiced pretty much everywhere, anywhere on the U of A campus. Even just by playing like beanbag toss in the backyard, that's like getting up for at least 30 minutes throughout the day and people aren't sitting down. So we decided that it's beneficial for everyone, even us weekly, to just kind of incorporate that into our day. And then towards the end of the semester, everyone was excited to learn how to incorporate simple activities into a healthy lifestyle. And that was really awesome to see.
Yeah, so individuals with disabilities typically aren't included in a lot of places that when it comes to like big health and wellness promotion efforts. So example, like there's a lot of inaccessibility in public places and gyms, and maybe people are even nervous to go into public to like work out or anything. So through these activities, Emma and I were very motivational and just encouraging, and we didn't pressure anyone. We had people volunteer, and there was actually a lot of people that volunteered to do our activities with us, and they were very excited. So it was really awesome that we were able to teach them these little everyday at-home tools to improve their knowledge and kind of change their outlook on, improving their health status. So the pictures on the right, the one of me and Emma and one of our students, we were on a walk and then we stopped by the College of Nursing and we just sat there and did a little drawing session, and they really enjoyed that. And then the picture on the bottom is the day that we made smoothies with everyone, and we kind of had everyone take turns and help, and they were all very very interested and excited to participate in making our smoothies with us. So thank you so much to Yumi and Diane for having us and having all of the artists and artworks and sharing this experience with us. It's really awesome.
Yeah, thank you both.
Thank you, Jodie and Emma. I could take a couple quick comments. I might save the questions till the end since I want to make sure everyone gets a chance to present, but thank you. I'll let you know if we have any comments.
There's a question. Should we answer it right now or?
Yeah, we can do one question. So what are some activities or exercises that seem to be the most popular or enjoyed by most?
Some of the physical ones were very popular. Like a lot of them asked to go on walks every time, and they're really interested to show us like these like hidden areas on campus. And then also like playing basketball or with the bean bags. They're really excited to like have fun, and we kind of made it a little competition too, so that was really fun.
I would also say the cooking, because you got to eat something at the end, of course.
Thank you, Jodie and Emma. If you have other questions for them, feel free to write them in the chat box or bring them up at the end of this section. Our next presenter is Amber.
Hi, my name is Amber Owens. I'm a junior at the University of Arizona, majoring in neuroscience and cognitive science, and I'm in the Sonoran Undergraduate Certificate in Developmental Disabilities program. So I looked at disparities in the healthcare system for people with disabilities and how the COVID pandemic affected access to treatment. To find my sources, I mainly used Mendeley and the University of Arizona Library Search, and used keywords such as disability, healthcare access, and COVID. So in the medical field, the medical model is like the basic model of disability that they use. But the medical model views disability as something that needs to be cured. And this mindset led to eugenics of the late 19th and early 20th centuries. And although society has moved towards a more community-based model, there are still cases of eugenics today, such as like involuntary sterilizations. While reading through the literature, I found that many physicians were uncomfortable working with people who had disabilities, with one survey finding that over 80% of the physicians they surveyed were uncomfortable. They also found that physicians viewed people with disabilities as having a lower quality of life. This is a problem because, 26% of adults in the US have a disability, and 1 in 3 of these adults don't have a regular healthcare provider. So people with disabilities, they also tend to have worse COVID complications And there has been many instances of hospitals treating less severe COVID patients without disabilities before they would treat the patients with disabilities who needed resources more, like ventilators. This actually breaks the American with Disabilities Act. And luckily, Congress stepped in and helped them, but a lot of people in the disability community had to ask them to do that. So there definitely needs to be more policies to prevent this kind of thing from happening. Medical schools also don't have a standardized curriculum for disability training, which probably leads to the doctors being uncomfortable working with these patients. And many families that I've interviewed said that they don't feel like they get enough support from their medical team. People with disabilities are also less likely to get preventative screenings such as cervical, testicular, and breast cancer due to lack of information and the doctors not telling them everything they need to know about it. So through this, I have found that we should incorporate disability justice and intersectionality in medical education and practice, and we should enforce policies to prevent disparities against people with disabilities when it comes to medical procedures. And we should also make doctors' offices more accessible to people with disabilities, like having adjustable exam tables for people in wheelchairs. For the future, I want to talk to more families and see their personal experiences and where we can go from there. I think we should develop disability medicine as a specialty in the medical field. And I think it would be interesting to look at the current and potential future policy to see how we can help this.
Thanks, Amber. Does anyone have any questions or comments for Amber immediately? Mendeley can be very helpful for anyone new to researching. It also makes a downloaded document screen reader friendly. Thanks, Ray. Amber agrees with Ray. She loves it. Okay, thank you, Amber. If anyone has questions for her, you have another chance at the end of this section to ask questions. All right, our next presenter is Noah.
All right. Hi, everybody. My name is Noah, and I am a sophomore right now at the U of A, majoring in physiology and medical sciences, and then I'm minoring in public health and Spanish. And I was able to do the FCM 493 internship this semester with Dr. Bashford. Alrighty, so throughout the semester, I had the opportunity to work with individuals with IDD, which is intellectual and developmental disabilities. And this was, of course, with Dr. Bashford, and she is a family and community medicine physician, and she is also a part of Sonoran USED. So coming into this internship, I am pre-med, so I obviously want to go to med school and specialize in a specialty. Right now I'm thinking pediatrics, but I've always had a focus on working with individuals with disabilities. I've had a few jobs in the past and done a lot of volunteering with it. So I was really interested, but I had not had that clinical side of it. So when this opportunity came up and I met Dr. Bashford at one of her presentations that she gave my freshman year, I reached out and was able to do the internship. So coming in, I really wanted to gain a better understanding of the healthcare needs of individuals with IDD and also the disparities and different barriers that individuals with intellectual and developmental disabilities do face on a daily basis. And then on a personal level, I wanted to kind of understand how important the patient interaction is, because in healthcare nowadays, we see such a mistrust between the patient and the provider. And that's one thing that I really sought to understand better throughout this internship, because Dr. Bashford has such an amazing relationship with her patients. And that's one thing that I did think I grew throughout the semester and hope to continue to grow on in the future. And then I do have a little bit of a idea that I may want to go into family medicine as well. So I wanted to see what a family medicine physician did on a daily basis. And then, like I said, understanding the health disparities was another thing that I wanted to get out of the internship. So for the method, every Thursday, I was able to shadow Dr. Bashford from about 2 in the afternoon until like 5:30 when the clinic ended. And this was at Banner South. And she would usually have about 5 to 10 patients come in each Thursday clinic who had intellectual and developmental disabilities. So I was able to shadow, meet the patients, ask Dr. Bashford questions, and just gain that understanding of what it means to be a family medicine physician who specializes in IDD. And then additionally, every Tuesday, we met via Zoom and we talked about different readings that I was doing, the patients that we saw, and just any questions that I had. And I additionally also wrote a paper about this internship, so we kind of worked on that as well. And then the really cool thing for me that I did throughout this internship was I got to kind of look in depth at one patient that Dr. Bashford was treating, and her name was Emma, which is not her real name, but just for HIPAA, her name is Emma. And it was really cool because I got to do an at-home visit and then also a clinical visit. So Dr. Bashford and I went out to Emma's house and we kind of got to see how she lives, her family setup, her support system, and her 2 dogs, which were really cute. And then next month, Emma came into the clinic and I got to see how the clinical side was different from the at-home visit. And just to give you guys a little bit of background information on Emma. So Emma has a Neurotube defect, which is connected to meningeal mylocial, and that impacts basically her whole central nervous system. So that's spinal and brain. So from the thoracic vertebrae down, she's basically, it's not functionable. Like she has trouble walking and other things. And then in her brain, she has something called hydrocephalus, which means there's a lot of fluid buildup in her ventricles in the brain, which increases the pressure, and that leads to headaches, nausea, and a lot of other medical conditions. So I knew that coming in, but then I actually got to see how that condition plays out in someone's life, which was really cool for me. For the discussion section, one thing that I was really interested in doing was comparing the at-home visit with the clinical visit. And this was really surprising to me because at the at-home visit, although she was very talkative and very at ease with people coming into her house, I actually thought that she was more calm and more responsive to the questions that I was asking at the clinical visit than at the at-home visit, which was really surprising because I feel like when individuals come into the clinic, especially individuals with intellectual and developmental disabilities, they're kind of hesitant to like open up and talk about how they're feeling. But given that she was so eager to talk and eager to tell us about her life, that just shows the big trust that she has with Dr. Bashford in the clinical setting, which is cool. Additionally, throughout the clinical visit and throughout the at-home visit, and then some research that I did on the side, I found 3 main impacts that a Neurotube defect has on the individual. So one is the effect that it has on walking. So Emma has a mechanical mobilized wheelchair, so she cannot walk, but she has that wheelchair and that's how she gets around. And then also transferring from location to location is another thing. So like when we just get up in the morning, it may be easy for us to get out of bed, go to the kitchen. But for Emma, she does not have that opportunity. So what she has is this kind of wooden board type thing, and she can take that, put it underneath her, and then she slides on the wooden board, and then she gets in the wheelchair with the help of her mom. But that's just one invention that has been created for this condition. And then the last thing is going to the bathroom and stuff like that. So she cannot go to the bathroom alone. She needs her mom, dad, other people that help her to go to the bathroom. So that's just another thing that I saw throughout this semester. And then again, like I mentioned at the beginning, understanding the health disparities is a huge thing. So a health disparity is defined as an avoidable outcome that is linked to social, economic, health, inequity and stuff like that. So one interesting thing that I kind of saw throughout this semester was we would have times where patients would be, 5 to 10 minutes late to the clinic. And that's because they had to get on a bus. And those buses can sometimes be late and stuff like that. And they don't have the ability to just hop in a car and go to the clinic and be on time. So that's just one disparity that could affect health outcomes and stuff like that. And then obviously, like, it was an amazing experience for me. It definitely showed me that I may want to do stuff with individuals with disabilities in the future. I still think I want to do pediatrics. And Emma was like 35, so she's an adult, but I still think I want to do pediatrics, but I do definitely want to specialize in something with disabilities because it is so interesting and there's so many health disparities that I want to help tackle. And then it showed me how important patient interaction was. Pretty much every patient that I saw had a smile on their face and they were so excited to see Dr. Bashford, and they would talk about, you know, their jobs and like what they did with their family and trips they've been on. And it was just so fun. And it was a really fun environment for me to be a part of. And then another thing that I kind of saw and will definitely take away from this internship opportunity was how big a support system is for individuals with intellectual and developmental disabilities, because they can't function on their own for the most part. So they need people around them that can help them go to the bathroom, help them make their meals, help them get to their jobs, help them get to their friends and stuff like that. And without that, they would struggle a lot. But Emma has such an amazing support system that she sees a lot of success in her life. For example, she has a job at Pekin, which is a non-competitive work environment that allows her to have social interactions with friends and allows her to make money as well. But without a good support system around her, she may not have that opportunity. And then I just wanted to give a huge thanks to Dr. Bashford for allowing me to shadow every Thursday, and then also to Sonora and USAID for this opportunity. And if anyone has any questions, you can email me or you can just ask them at the end. Thank you.
Thank you, Noah. If anyone has questions, I'm going to wait till the end of this section for questions for Noah, because we do have one more presentation. So I'm going to try to get to that before we run out of time. And our last presenter is Samantha.
Hi, my name is Samantha Zwillinger. I'm majoring in speech, language, and hearing sciences, and I'm a trainee for their certificate program for developmental disabilities. So I'm going to be talking to you about how I discovered the best practices for working with adults as a speech language pathologist, or SLP. So first, what is an SLP? SLPs focus on developing speech, language, and social skills with adults with various disabilities. And as a future SLP, I wanted to find key information that could help SLPs navigate effective strategies for various conditions. So that is why I came up with creating a tip guide. Having all this information in one place can kind of serve as a baseline document or resource for SLPs to refer back to. I feel like sometimes practitioners could get into a habit and maybe applying the same technique with all patients with a specific condition, for example, like aphasia, but it might not be the most helpful technique when there are multiple approaches an SLP can have. So being flexible and creating individualized plans are essential. So looking at the methods section, I collected my data by reviewing scholarly articles, and I also looked at gray literature. And then I also interviewed SLPs and related professionals about their personal experiences working with adults with disabilities. So now looking over at the results section, this is my tip guide with 12 main points. And then the full tip guide contains subpoints with specific tools. So first, involving the family or caretaker is critical, not only to viewing the patient holistically, but developing a support system. And I found that family-centered practice and teaching the family or caretaker to implement practices in the home are just some ways that the client can be supported. And one thing I kind of found interesting was that in one of my interviews with an SLP, she mentioned that in graduate school, they weren't really trained to act as counselors to their patients. Yet in the working field, she realized that those skills were essential to connecting with the patient and supporting their individualized needs. Next, SLP should also consider the power of language. SLP should replicate how the patient speaks about themselves. Next, SLP should make connections with other agencies and professionals, as collaboration is common within their field, and often patients have comorbidities which ask them to see different specialists. So this is important to be able to refer clients to other professionals and have knowledge of client limitations. And then also just to further patient care, one practice that I found to be really helpful for SLPs to collaborate with other professionals is the interprofessional collaborative practice. This practice kind of brings together all professionals involved in a client's life to create more of an individualized plan. Another tip that SLP should follow is implementing evidence-based practices into their work so that they can just stay up to date on new knowledge in the field and provide the most effective treatments. Another tip focuses on the environment of the client and where SLPs practice skills to promote independence. Working in the community provides a very realistic practice, but if SLPs do work more in a clinic, it's important that they practice activities of daily living so that clients can implement such skills outside of the clinic and just in daily life. And then a final tip is that I feel like there's always room for building upon skills specifically with technology. And so I found through my research that SLPs are always trained with on alternative and augmentative communication devices, or AACs, and then also telepractice. Being skilled in these areas provides greater access to tools the patient could greatly benefit from. And so looking at my conclusion section, I just want to emphasize that utilizing this tip guide would improve the versatility of work values and hard skills that SLPs have. And it can be a place to refer back to for recommendations of how to improve. And it can also be a place that has universal practices that are key to working with adults with disabilities. And then just another note, in the near future, I'm going to be working with the University of Minnesota on a project where I'll be interviewing adults with disabilities on home and community-based services. And my hope is that this will give me more information on what services disabled individuals feel need to be improved, and then hopefully find out how SLPs can continue to improve. So thank you.
Thank you, Samantha. I'll go ahead and take questions now from for anyone from that last section on health and wellness.
I've got one. And it was more with Noah's an interesting, or it's a comment and a question. You mentioned the sliding board that the person that you visited uses, and one of the things that I see in having a disability myself, developmentally, is the lack of equipment that the doctor has to help the person transfer in the office. So, which I believe, and this is not evidence-based other than my experience, affects the outcome of the health intervention, because we can't get a proper physical, and if they can't get us onto the table, and or they ask for the family member or the personal care assistant to help, but not everyone has that. So did you see any of that? And what do you hope to do differently in your practice?
Yeah, that's a really good question. So at home, when Emma was using it, she used it to get from her bed to the wheelchair, and she definitely couldn't do it alone. Like, her mom had to help her move. So that again ties back to what I was saying with the support system, how important that is to have people around you that can help you. But then in the clinical setting, she didn't use them too much because she just stayed in the wheelchair. But a cool thing at most clinics, and Dr. Bashford had this too, they have exam tables that are not as high. So it's easier for people to get onto them if they need them, and you can like move them down. So that's one thing I saw, and something that's definitely needed, but I feel like something that not enough people think about, but it's definitely needed because we have to, you know, think about those disabilities and how we can manage them and make adjustments to help people that need them. So I would say it's definitely something that needs to be worked on, but more and more practices have adjustable exam tables and other things in place to help people that have disabilities.
Thank you.
Could I make a quick comment if it's okay? Sorry, I'm in the car, so I'm not sure if you guys can hear me well, but I just want to make a comment for Emma and Jodie that, you know, they talked about the health activity change came easy for them to, you know, impact the artists with IDD, but that is largely based on their approach, how they really created the curriculum and activity in collaboration with artists, you know, who has preference and their own excitement. And then also the direct care staff who understands what works best for them. So the collaborative capacity of Emma and Jodie make it very successful. Just I wanted to make the comment about it. So I was pretty much hands-on and put it on Diane, one of our staff member. So I just want to congratulate, and I want to point out that fantastic part of the collaboration part. So thank you.
Thank you so much. Yeah, it was definitely awesome to see how a lot of them were actually really excited for us to come the next week, and they were all just giving us so many ideas of what they wanted to do. So it definitely spoke a lot about like how engaging Emma and I were actually making like a positive impact.